person-centred or client-centred therapy was the first therapy to be based on research. And there's an apocryphal, possibly, story, it's probably got some roots in fact, that Rogers was working as a psychologist with veterans, and there was one veteran who was just in such emotional pain and had had so many terrible things happen to him that Rogers felt that anything he said was just not going to be enough. So he didn't say very much. He listened and, really attended to what that person was saying. And at the end, they turned round and said, "Thank you, Dr. Rogers, that was the best session I've ever had." So it made him start thinking, because his training was, as most people's was in those days, based on the ideas of Freud, psychodynamic, psychoanalytic therapy. So he and his colleagues set about doing some research into what actually works. Never mind people's ideas of what might work and what might not work. What really works? What do clients find useful? What do clients find helpful? So what I'm about to tell you is based on that research, and obviously it's been refined over the years since and continues to be refined. It's not exactly the same as was. The other thing, perhaps just to say at the beginning, is I wanted to have some books for you, but because the publisher Sage is in temporary offices at the moment, they haven't managed to get them here. But I do have a code for 25% off, which is on the last slide. So if you do want to buy any books, you can buy them on the website at 25% off. Okay. So the first thing to say is that theory is really, really important because it gives us a base, it gives us a map. And to start with, at any rate, when you're starting out as a therapist, it's actually very difficult to stay with someone who's in pain or who's anxious, without wanting to do something about it. And if you don't have that map to make yourself feel useful, you might reach for this bit, bit of this, bit of that, to see whether something works for the person. So it's really important to have a coherent theoretical map to guide you when you're working with people. Okay? Now, what we're used to believing, what we're told, is we equate complicated with difficult. Person-centered theory is not complicated, and it's difficult. Yeah? So the more complexity you put in, the more we think, oh, that's good because, we're learning more. But actually paring it down to you in relationship with one other person and being really there for that person is much more difficult than having a bag of techniques that you can draw from. Okay. And we need that map. We need to anchor ourselves in a really good theory. Okay. So, this is a bit fussy as a slide, sorry about that. But we need a set of assumptions and hypotheses that will guide us through our work. So what do we mean by person and personality? That's different in different approaches. How do we understand the way that people develop? What do we think of? What is normal, healthy, or adjusted? How do we define that? What does it look like? What do we consider to be abnormal or unhealthy or maladjusted? And how do those states arise? And more crucially, how do people move from 4 to 3? You know, what's the process by which people can move? And of course, the crucial one for therapists, how can others best assist in that process? Okay, so if we're going to have a good working therapy, our theory needs to answer all those questions in a coherent way. Okay, so in person-centered therapy, personality has 2 components: experience and self-structure. So experience is all the things that come in through our 5 senses and through internal visceral feelings. So that's informed by things that are happening to us currently, but it's also informed by significant past events. You know, you'll know that you can have a reaction to something that's happening now that isn't logical. You know, it's based on a previous experience of yours. And the reason why we say significant experience is that a lot of our experiences don't impact us in the way that some experiences do. And the self-structure, which is our model of the way around us, and that's very culturally oriented, part of its function is to keep things out of awareness. You know, so if experiences aren't impactful, then the self-structure, you know, we don't, for example, in our culture, we don't think about the ground beneath our feet. Whereas in an earthquake zone, it might be something that's more in our awareness, because we're used to ground being solid. In our culture, we don't even think about spitting. Ours isn't a spitting culture. But in some cultures, spitting is an everyday norm. So that's kept out of our awareness because it's not relevant to us in our culture. Yeah? So that's the self-structure also serves for us not to be overloaded with information that we don't need. The crucial thing about the self-structure is it enables us to fit in. That's where we get our love from, our acceptance in our own particular community and family, whatever that means. Okay, we're accepted, we're valued, we're loved. And that's what the self-structure does for us. So it includes the self-concept, what I think about myself, and also what I think about the world. And it has our values in it. And some of those values, quite a lot of them to start with, will be handed down. You know, people like us, I don't know, vote Tory. People like us believe in God or don't believe in God. People, you know, so there's an element that is culturally and familiarly determined in the self-structure. And clearly that's not in our awareness to start with until we come up against other values and other people's self-structures that might differ. And the other thing it does, it gives us predictability. So I know that if I say this, it's going to be greeted with approval. But if I say that, I'm going to get criticised or people are going to be shocked. Yeah? And as a child, predictability is really important. Okay. So what we have is experience and self-structure, and the part where they overlap is the part that we call congruence. And that's a really important concept in person-centered therapy. because congruence is the area where we have some choice. If something's out of our awareness, we're just going to act on it without feeling that there's a choice. A very simple example is you see, and the other thing about congruence is you can change your perception from minute to minute if you get different information coming in. So, very simply, there's a bowl of a white substance. Oh, it's a bowl of sugar. You go like that. Oh, no, it's not, it's salt. There's nothing that gets in the way of that. And that's what congruence is. It's the area of personality where our experience is available to our awareness. And we have choices when we're operating from that congruent area. Okay, is everyone following me so far? Good. It's always a good sign. Let me know if you're not. So, when we're talking about people who are in emotional pain, it's often because significant amounts of their experience are not available to their awareness. That central part of the diagram where you're congruent, you're aware, you know what your experience is and what your experience has been. So, what I want you to do is just talk to the 2 or 3 people next to you. Okay? So, and I hope you've got some paper that you can write on. So, if you have an experience and your self-structure says, I'm no good at maths, but your experience is that you do a sum correctly, how might you deny or distort that experience? Just talk with the people next to you. So, can somebody suggest a way that experience might be denied or distorted? Yes, please.
To discount.
Discount, yeah. It's as though it didn't happen, yeah. Anything else?
Or it happened by chance.
It happened by chance? One-off. It's a one-off, it's a fluke, yeah. Because I'm no good at maths. Yeah?
That wouldn't mean it was luck. It was luck.
It was luck, yes, it was luck. Okay, so B, men don't cry, okay.
Some people do.
Say again?
Some people do.
Yes, but if this is in your self-structure, if your self-structure is men don't cry,
Some do.
yes, but that would be in the area of congruence, and we're talking about someone whose self-structure, whose experience is not congruent. So in other words, they're not able to symbolize their experience accurately, okay? And the experience is, I'm upset and I'm getting choked up. So how might that be denied or distorted? Yes, absolutely. Because real men don't cry, okay?
It might be generational that you've been taught to believe.
It will be to a large extent generational. On the other hand, it's also to a large extent cultural. Yeah? I mean, I certainly grew up in a culture where that was the belief. Real men don't cry. So, sorry, there's someone at the back?
I'm not feeling sad, I'm feeling angry.
Yes. Excellent. That is a very, very common distortion.
Can you repeat that for me?
I'm not feeling sad, I'm feeling angry, which is a very common distortion. There's a bit of a saying, watch out for the man who's angry and the woman who's tearful. Because of the socialisation, we might be socialised into expressing as women, I certainly was, it was much easier for me to cry. Even when I was furious, it would come out as tears. And for men, it will often come out as anger when they're deeply upset. Okay, so that's, yes, that's a very, very common distortion. Any others?
What if someone says to themselves, what's wrong with me? Because I feel like this.
Yeah?
Is that a distortion or
Well, it's kind of moving into the area of congruence, isn't it? Because it's kind of starting to wonder. Yeah? So it might be something on the edge of a person's awareness that they're willing to move that boundary, if you like, and accept something into awareness. Yeah.
I think also for some men, there's a sort of train of thought which is, if I experience such an emotion, I'm therefore feminized, and then there are then questions of sexuality. Am I gay?
Yes. So it's this gentleman was saying that if they experience that, it moves into the area potentially of questioning their sexuality.
So it's like, perhaps you should rewrite that as straight men don't cry.
Oh, straight men don't cry. Possibly so. Yes, absolutely. Yeah, that could be. Yes.
I was going to say it could be distorted to become a utilitarian view where a person might say, my tear ducts aren't functioning correctly.
Yes. Yes. I've got problems with my tear ducts. Yeah.
I mean, yes, I did cry, but it's very rare because Liverpool lost or...
Yes. So it's very, very rare, only when something terrible has happened. Okay, sorry.
I'm strong, that's why I don't.
I'm strong, yes. It's getting stuffy in here. I'm getting choked up. It's stuffy. So I'm not crying. Okay, let's move on to the next one. Black people are. You know, there's lots of racist assumptions out there, aren't there? So if this is part of your self-structure, and somebody says, but hang on, you've been working with Winston for years, and he's a very hard worker. What might be the distortions and the denials there? Talk to each other. So what distortions and denials are we getting there?
Cultural bias. Cultural bias.
It's cultural bias is involved. It's built into that particular self-structure. But what might the distortion and denial be?
Like, oh, he's different.
He's different, yes. It doesn't affect that self-structural belief, which is why you can't apply logic to the self-structure. You know, it's not the way it works.
Can I just make a suggestion?
Yes.
You're doing a thing on black people are lazy
Mm-hmm.
and saying about how there's a distortion in denial and culturally. You've called him Winston.
Okay.
Can we call him something? Like, it could be David
Absolutely.
or John.
Yes, yes. David or John is fine. It buys into the stereotype. Yeah. Okay, that makes sense. I will do that in future. Thank you.
No, I was going to say, he may be working hard, but he's still lazy compared to other people. It's a way of denying
Yes,
that
yes.
he's hardworking.
Yes, it's denying his hard work. It can be, yeah. So he's working hard, but other people might be working harder.
Yeah, so he's still
Yes,
lazy,
yes.
because that's your belief.
Okay, last one. I'm a high achiever, but I can't get something right. What might the denials and distortions be there? Okay, so we're getting some suggestions. Yeah. Oh right, I got it right, but they've misunderstood. You know, they're not accepting that I'm right. Okay, yeah.
Denial.
Anything else? Oh, it's impossible, yes. It's stupid because I'm a high achiever. If I can't get it right, it must be impossible. Yep. Yeah?
I'm having an off day, or I'm...
Oh, yes. I'm ill, I'm having an off day.
But that might be congruence to actually admit that you can have an off day.
It might be, yes. And as you say, you don't know until you know the person, really. Yeah. They haven't given me enough information. You know, so there's all kinds of ways that that self-structure gets maintained, even in the face of evidence to the contrary. Okay? When experience, significant experience, and the self-structure are in conflict, the person will experience anxiety. Yeah? And there's a continuous tendency to integrate significant organismic experience into the self-structure. It's a continuous drive. We call it the actualizing tendency. People have likened this to, you know, it's like individuals are always moving towards integrating more of their experience, symbolizing it accurately in awareness. But it's the uncomfortable emotions that bring people into therapy. If they, you know, if their self-structure isn't so rigid that they couldn't possibly access therapy because people like me don't need it, you know. So it's a bit like you hurt your leg. You know, your leg's aching. It's a signal that you need to pay attention to it. And it's the same with emotions. Those uncomfortable emotions, anxiety, painful emotions, distress, fear, are signals, and of course angry feelings, are signals that something needs some attention, that something's not quite right. And that's when people come to see a counsellor or psychotherapist. And often they don't even know necessarily what it is. They just know they feel bad. So yes, there's that actualizing tendency, that underlying push for us to acknowledge that significant experience and integrate it into our self-structure, and thereby increasing that area of congruence. So that push always is to make the area of congruence larger. And it happens slowly. It's not big, sudden things usually. Although I suppose sometimes it can be. But through the process of therapy, what it's been likened to is growing plants. You can't grow a plant. You can't, you don't get hold of it and grow it. You surround it by what it needs and it grows. If you give the plant the right conditions, it will grow. And you can't make a rose into a tulip or vice versa. But if you give it the right conditions, it will become the best rose or the best tulip it can be. Okay, and that's the fundamental premise of person-centered therapy. So it's the slow, gradual acceptance into the self-structure of experience that to a certain extent has had to be denied and distorted to fit in and be accepted in that particular family. Okay? And that's the actualizing tendency working. That's somebody knowing that they don't feel right, knowing that they're feeling lonely, miserable, not good. So how can we help? The self-structure under threat defends itself. If you attack someone's fundamental beliefs about themselves and the world, it'll become rigid. I mean, we all know that, don't we? You don't get anywhere by saying you're wrong. Have you thought about this? Look at the evidence. With a self-structure, that just makes it defend itself. And it will be even better at denying or distorting experience. So change comes about when there is an absence of threat. The therapist needs to support and enable the actualizing tendency. Because that's the thing, you know, it's like the plant growing. If you can give the individual what they need, then they're going to start accepting those denied or distorted experiences into their self-structure. They're going to become more congruent. Now, Rogers and his colleagues, again through their research, and Rogers always said, these are hypotheses. We have to continually test them out. He was, really, really keen. All his colleagues were, all person-centered therapists are, keen on saying, let's not take these things as read. They hold true until we get evidence to the contrary. Now, of course, we've got quite large numbers of years' evidence that these do hold true. And the 6 conditions for therapeutic change, the first is that 2 persons are in psychological contact. The second, that 1, the client, is vulnerable or anxious. The third is that the therapist is congruent in the relationship. Now, people sometimes think being congruent means just saying whatever, comes into your head. That's not at all what it's about. It's about receiving your client in that area of your personality where you're not having to deny or distort anything that the client is telling you. So that's what's important about it. It's being able to really receive everything your client tells you without you distorting or denying what your client is saying. One of the things I did, it wasn't intended to, provoke that response. I do quite a lot of role play with students, where I'm the client and they get a chance to talk about what their responses are going to be. So I'm role playing a client let's call her Jenny, who's talking about being in an abusive relationship. Is talking about, how that's impacting her, how it's impacting the children, all the rest of that. And as the client, I began talking about Helen, thinking it was obvious that Helen was my abusive partner. But the students started distorting and denying that. Not all of them, but some of them heard it as Alan, because, abusive partners are always male. Yes. Some of them thought, well, I wonder who Helen is. Perhaps Helen's her sister. So, that's the impact of us not being able to be congruent in that relationship. And it's why supervision is so important to us. Because supervision in person-centered therapy, what we're trying to do with our supervisor is expand our area of congruence so that we can be more available to the client. That's the purpose of it. It's that area of congruence that we need to be bringing. Okay. So the fourth is that the therapist experiences unconditional positive regard for the client. And again, this is often misunderstood. Yes, it involves not being judgmental, but then we all make judgments, don't we? So again, it's the area of congruence. If we're making judgments, we need to be aware of the judgments that we're making and not make assumptions. Okay, we'll look a bit more about UPR in a minute. The therapist experiences empathic understanding of the client's internal frame of reference. It's a phenomenological approach, person-centred therapy. You don't look at anything from the outside. It's always looking at it from the client's frame, from the client's own frame of reference. How are they experiencing the world? How is their self-structure impacting on them and the way they go about things in their lives? And 6, of course, is that the client can perceive 4 and 5. You know, and there might be a number of reasons why the client can't perceive those things. The obvious ones is that they've, you know, taken various substances and they're just out of it, you know, so they're not. And that's true for number 1 as well. Often though, not often, no, that's wrong. Occasionally a client will come and their self-structure is saying, I'm useless, I'm not worth bothering about, I'm a waste of space. Yeah? Now their experience of you as a therapist is that you are treating them as though they're not useless. They are valuable. Yeah? And that of itself is going to create anxiety because their experience of you is conflicting with their self-structure. So with a client like that, they might, you know, there might be some DNAs because it doesn't compute. You know, I'm not, sorry?
DNA?
Oh, sorry, do not attend, did not attend. Yeah, thank you for asking. Yes. So you might get clients that don't turn up because of that anxiety they're experiencing. Because their self-structure is saying, I'm worthless, I'm useless, you know? And they're having an experience with a therapist that is, you're valuable, I'm listening to you, I'm taking what you say seriously. So just that very context can create anxiety. Okay. So empathy, again, empathy is so fundamental. It's, you know, it's not just a simple restatement of someone else's words, which is often the way it's been characterised. It's really sensing somebody's meanings. When people come into therapy for the first time, if they have not had their experiences named when they were growing up, all they can tell you is, I feel bad. They don't know because it's never been symbolised accurately for them. They don't know whether they feel distressed or afraid or upset or, you know, anyone, you know, anxious or depressed, because no one's ever named that experience for them. And we know now from brain imaging techniques that if babies aren't empathised with at a very early age, their brains don't develop properly. They don't develop, more crucially, they don't develop mirror neurons. So that ability to empathise is passed on. Sorry, that's a side issue. Okay. But it is an exploration of someone else's inner world. And one of the worst things I hear is, and how did you feel about that? It's a journalist's question, it's not empathy. And yet people think it is, because you're not sensing it from the other person's point of view. The other thing about empathy is it's a continual dialogue. So you're voicing it to your client the whole time for them to correct you if you're wrong. Yeah? So it's always, is it like this? No, it's more like, okay, it's like that. So it's a dialogue, it's not something that's fixed. And empathy involves two things: perception, so you have to perceive what the other person is feeling, and communication, you have to communicate it. So people will say that they're, I was really feeling for the other person, and they will think that is the total sum of empathy as we understand it. Clearly, it's a big part of empathy. But in terms of its therapeutic value, it has to be communicated. It's a bit like someone's had a horrible thing happen to them, or they've lost somebody close, and you're kind of really feeling it, and you're seeing how distressed they are, and what comes out of your mouth is, "Shall I make you a cup of tea?" It's that kind of, I don't know what to say. So empathy does involve communicating what you have perceived of the client's world, their inner world, so that they can correct you if you're wrong. And then if you get closer and closer to clients, and that sense of somebody really understanding me is absolutely crucial. Okay, so what I'd like you to do, with your next door neighbour in a group of 3, whatever makes sense, is to just choose one of those headings and write down all the phrases, words you can think of that describe a tiny little bit of it to a great huge amount of it. Because empathy is also, if you just say, "Oh, you're feeling angry," it kind of doesn't do it half the time, does it? It's a very blanket word. So, you're feeling a bit miffed, you're feeling furious. Do you see what I mean? So it's about also developing a vocabulary of empathy so that you can choose the right amount. And obviously, you're also choosing your words and phrases partly dependent on your client, I wouldn't say probably to an elderly woman, "Oh, you lost your bottle," but I might say it to a, teenage lad. Do you see what I mean? So it's developing all of those words and phrases. So just give yourselves a couple of minutes to choose one of those with the person next to you and try and identify tiny amounts and huge amounts of it. And everything in between. I'm not going to ask you to share those because there might be a lot, but it just gives you, it's almost irrespective of what your therapeutic orientation is, it is useful to have that vocabulary, to communicate to your clients that you've really understood them. So that's what person-centered empathy is. Unconditional positive regard, big mouthful, but it's the fundamental assumptions that everyone has good reasons for everything they think, feel, say and do. And that by really listening and really empathising, you can begin to understand why people are doing what they're doing. Yeah? So that's the first. And the second is that all our effort is an attempt to reconcile organismic needs and self-structure in the best way possible for that person at that time. Beginning therapists often make the mistake that experience is better than self-structure, that emotions are better than cognition. No. It all has to be integrated. Now, we tend to pay attention to emotions because, as we've said, that's the signal that, that something needs attention. But actually, cognitions are important as well. So it's a question of finding the balance if they're out of kilter. And the self-structure is what enables us to live in the world, to live in our society, to live in our family. We're not trying to overturn the self-structure. We're trying to increase that area of congruence because that's where people have choices. Yeah? So if you're working with someone who is, who knows, for example, that leaving a relationship would involve being cut off from family, from society, they've got difficult choices to make, haven't they? So it's not your job to push them one way or another. You have to empathise with the self-structure as well as the experience. They're really important for that person to make the best decision they can at the time. Person-centred therapy is often called a non-directive therapy for that reason, because we can't know what is best for our client. We cannot know. And if we start pushing them in one direction or another, we may well get it wrong. We have to give them the time and the space to come to their own decision. And then the choices they make are much more likely to be the right choices. And the other thing, I will often say to clients is, whichever choice you make, it will be the best choice you can make at this time. Yeah? And because it will. Even if you might have regrets in the future, it was still the best choice you could make at the moment. Right, so let's have a little look at Jasmine. So again, talk to the people next to you. What's your immediate reaction to Jasmine? So she's saying, tell me how I can put my kids in care. I hate them. They're always doing things they shouldn't. Hitting them doesn't make any difference. Locking them up in their rooms doesn't make any difference. They just cheat me all the time. They make money from me and Tony, and he says he's going to leave me if I can't control them better. Well, I can't, so they'll just have to go. So what's your first reaction?
Jasmine's at her wit's end and there's a lot of frustration going on.
Yeah, is that your immediate reaction? I don't like her. No, this is not a nice person.
We were saying that it feels like an unsolvable situation that might be very difficult to sit with.
Yes.
Because you have a tendency to want to think like there must be some sort of solution to this.
Yes. So you're wanting to solve things comes into play. Good, yes.
But from her point of view, she's in conflict between her relationship with her husband and her kids.
Yeah. Okay.
You might worry about the children.
Yes. What about the children? Should I be doing something? Yeah. Yeah. Yeah.
Why is she there in the first place? Is it because she's there voluntarily or because social services have sent her there?
Yes. Is she here voluntarily or has she been sent? Yeah.
I'm sure they're not always doing things they shouldn't, and who defines what they should
Yes.
and shouldn't do.
Okay, so it's really important to know what's going on inside you, isn't it? Because you have to be able to put that to one side to get into Jasmine's frame of reference. And if you don't know, it will leak. If you don't know that you're concerned about the children, you might start, angling what your responses are to be more focused on the children than you are on Jasmine, for example. Oh, have you thought about, these kinds of phrases are all little ways in which we subtly point people in one direction or another. Okay, so the first bit about congruence is knowing what your reaction is, because then you can prevent it from sort of leaking out. I mean, the other thing about this person and many others like her and him is that all the services will be looking out for the children. You might be the only person in her life that is actually concerned about her and not the kids. So if you go down that safeguarding route, I'm assuming here that there are other agencies around that will be, looking out for the kids. If you go down that route as well, she's got nobody. Okay? So in line with what you were saying, so later on, because you have to assume that you've started by offering those therapist conditions, that the 6 conditions are there. So she's able to say, I just can't cope anymore. I couldn't bear to be on my own. I sometimes wish that Tony would do more with the kids, but he just doesn't want to know. All he does is order them around, which works when he's there, but he's never in nowadays. He always said he was no good with kids, but I thought it had changed when he had his own. I wanted kids so much. I was going to be completely different from my mum. Not hit them, not shout at them. But I'm useless as a mother. I get wound up and just scream at them. They'd be much better off without me. So because you haven't attacked her self-structure, she's starting to be able to really acknowledge her own experience in all of this. Okay? And then there's just one more. I feel so lonely sometimes, and she starts to become tearful. I'm sure Tony's going to leave me sooner or later. I've tried so hard to keep the family together. I'm just useless, no good to anyone. My mum always said that. She knew I'd make a mess of things. Yeah. So we're getting someone who's starting to express and really experience their own perspective. Okay? I suppose the only other thing, I've kept this at a fairly simple level, I suppose. But one of the things that I wanted to say is the way you kind of work in therapy, and it's back to the theory, partly depends on what your default position is. If your default position is that we are driven by a selfish and destructive id, you're going to behave very differently, when people come in extremis to you. If your default position is that paying attention to things like voices and visions, that kind of thing, altered realities, reinforces them, you're going to do what the cognitive behaviourists have typically described as avoiding the psychotic pockets, because then you're not reinforcing. Do you see what I mean? So if our default position is that people are always doing the best they can, that, for example, voices are a distortion of experience, and that if we can really hear what the voices are saying and accept that, they are there for a reason. There's something in that person's experience that they haven't been able to integrate into their self-structure, probably at a very young age. Same with flashbacks and so on and so forth. Essentially, that's me finished. So if you've got any questions, I'd be very happy to hear them.
Thank you, that was very revealing. A question I have is relating to empathy. You mentioned empathy. Mm-hmm. So the question I have on that is, can you perceive if you have not actually experienced that yourself? Can you have empathy for somebody if you haven't experienced what they're going through to whatever degree it is?
I think it depends on whether you've kind of experienced the emotion rather than experienced the event. Does that make any sense? So if I have experienced distress, if I've experienced loss, it doesn't matter whether it's the loss of my mother or my best friend. You know, I'm kind of...
Well, if I could just, a personal experience I've had on that. I broke my leg very badly once, and I had a number of therapists helping me through water therapy and so on. And the nurse who had actually broken her own leg at some point, had a tremendous different approach to me. I felt she had tremendous empathy, where the others it was just mechanical. And that's why I raised that question.
Yes, yeah. I can really understand what you're saying, and if your training and your effort is to develop empathy, then you will become better at empathising even if you haven't broken your leg. And that's partly through reading and, you know, there's all kinds of ways we get information, isn't there? And books and reading vicariously about other people's experience is one of those.
Hi, I don't really have a question per se, but I haven't formulated what I'm going to say properly in my head, but I just want to make a comment further to what the lady said down there in the beginning of one of your slides. I just think it's quite important for me to say this, that in a white-dominated environment where black people are a minority in this room, I would say that the slide where you talked about men and being a high achiever and maths, and then like kind of then saying, oh, black people are lazy, the lady next to me said, oh, I didn't know that. So I just wanted to say that it's quite unsettling and offensive, and I was about to walk out and I thought, actually, I'm just going to say it because it's important that I don't want to be a part of something that I feel offensive, like I feel offended, and me walking out would have just been ignorant. And in line with being congruent, I would just like to say that perhaps that's something that could maybe be thought about when you're in an environment where, you know, you're not a person of, well, you're not a black person and a person of colour, and there's a lot of, you know, I am a minority in this room, and I feel very uncomfortable. So I just wanted to just voice that.
Thank you. I will think about that. Funnily enough, I have changed that several times from, you know, gay men are effeminate. It's trying to get at the kind of prejudice that is not amenable to logic. So I'm really sorry if that particular instance, I mean, if you can think of something that wouldn't, perhaps, that would do the job, as it were. But I will think about it. Thank you. Thank you for saying that.
So my question is, as a therapist, like any relationship that you have, it's natural to have some doubts about it. Are there points at which you think, I don't know whether this is working for my client, whether I'm right for my client anymore, or they need something different because the therapy has meant that they've actually become someone new? And the flip side of that, of course, experientially for a client, what are the markers, the flags, the doubts we should listen to as opposed to the ones we should ignore, where we might need to say to ourselves, I've actually gone as far as I can with this person. Or, no, get over yourself, this is still good, just carry on.
I mean, I would check it out with the client. I mean, one of my big markers is if nothing seems to be happening and I'm getting a bit bored. Because I know if clients are really talking about stuff that is meaningful to them and you know, there's an emotional content to it, I don't get bored. You know, the hour goes past like that. But if they're talking in a way like, you know, you could be doing this in the pub, then I'm going to be starting to say, look, I'm not sure how useful this is to you anymore. Or if they're resisting me and they want me to give them advice or tips or stuff like that, then again I'll say, I'm not sure this is the right therapy for you.
Do you think that's true the other way around? In other words, as a client, if you're feeling, obviously if you're feeling bored, perhaps, yeah, this is the wrong person. But
As a client.
But is that a good measure for a client to be thinking, actually I'm getting stuff out, which I'm enjoying, hearing myself discover, thinking, talk about, I'm moving still. Is that really the thing that you think viscerally is pointing to the fact that this is positive?
Yes, yeah, absolutely. I mean, sometimes clients don't want to let you go. You know, if you've been important to somebody, and I've got various analogies, and one of them is, okay, you're climbing a mountain. You don't have to do it in one go. You've got to the point where you can sit and enjoy the view. Enjoy it. Come back. You know, when those difficult feelings come back again, by all means come back to me. But at the moment, it feels like we've done as much as we need to for the present. So I think you have to, both of you, trust your judgment. Yeah. And as you say, trust the kind of the feelings that you have when you're in relationship with the client. Someone behind. Oh, right, okay.
Thank you. I used to be a volunteer mediator, which was a form of non-directive counseling, I think. But I'm curious, and maybe a lot of people in this room already know the answer, but I'd be interested in these 3 slides you've just done, what the therapist might have said in between in person-centered counseling, and how you help in a non-directive way, how you help the person to get up, you know, as opposed to they're maybe sort of circling around and not getting anywhere, how you help them kind of dig in.
Empathy helps people to go deeper. If people are telling a story, and some people will just rattle on with the story. When you start empathizing, you're slowing somebody down, you're helping them to get in touch with, if you like, the underlying stuff. And that essentially is how it works, because it's about increasing choices, as I said. And Jasmine now, it's partly about increasing choice, and it's partly about expressing feelings. Significant events and their feelings are held somewhere in the body. I'm not quite sure how it works, but would you all recognise that they just sit there and they're waiting to come out? So being able to express stuff and grieve stuff. You know, Jasmine probably has quite a lot of grieving to do about what she didn't get as a child from her mother. So that might be a process that she needs to go through before she feels she's got the energy, because keeping stuff under takes a lot of energy. And once we start expressing it, it releases some of that energy for us to use in our everyday life. Is that? Yeah.
This really piggybacks onto the last question. You said that the therapist does not attack self-concept. If the therapist does not attack this self-concept, it allows the patients to express their own self-structure. Can you elaborate on that? Because, I mean, I can imagine if the therapist had said, what about the children?
That's pretty attacking.
Yes, she would have been very defensive. But, so I mean, there's much more involved, I'm sure, than that.
But the first step, going back, and I think you said something of that, didn't you? Is the kind of frustration. So you're feeling really frustrated that the kids won't do what you say, and it feels like you're just at the end of your tether with them. And so, you know, that's the point at which the self-structure can start to loosen a bit. Yeah?
So having that voice available to listen, where it sounds very much as though Jasmine's had nobody else listen to her. And if they have on the odd chance, then they probably been judgmental, and this is the first time that she's been able to be in a position with a decent person-centred counsellor would not judge the situation just by looking at it en bloc as what it's presented as, but to look at Jasmine's feelings that she's bringing with her.
Yes. So that's about, not being judged, having someone to really listen to what you're bringing. At the moment, at the first instance, that is a very monodimensional view, isn't it? But once you've really heard that and understood, and the person feels that you are going to value them, that you are going to look for their good reasons, then their self-structure can start to loosen, and they can accept some of the some of their experience in. Sorry, did you? Oh, okay.
I have like two parts to the question. The first one's just for clarity. So if I was to seek out like a person-centered counsellor and a person-centered psychotherapist, what would I notice a difference? And the second one is, can empathy be taught? Because I went to medical school and we had simulated patient sessions, and I felt like empathy was a tick box exercise, and we worked on like this thing called ICE, which was as long as you ask a patient's ideas, concerns, expectations, your examiner will be satisfied that you're empathetic. But I felt like that was kind of a fake empathy. And I also want to ask whether there's like this energy of empathy that exists between a patient and client in like the room. And now we're going towards like this telemedicine thing where people are behind screens. So there you still have the language of empathy and you still can see a patient's reaction on the screen. But can you still achieve the same thing if you're not physically present?
I have done Skype counselling sessions, and that does seem to transmit. The other thing to say about empathy is it takes time. You need to really be able to sit with someone and let sink in what they're saying, and then formulate how you're going to check out that you've heard it correctly. It's not quick. And I think one of the things about doctors in the NHS is they don't have that time, I mean, it's... Anyway, I'm not going to go there. And the question about would you see a difference between a counsellor and a psychotherapist? If they're well trained, probably not. There used to be an old saying, the difference between a counsellor and a psychotherapist is 20,000 a year. But it also depends where you're working. I mean, if I'm working in a college or a workplace and I put psychotherapist on the door, no one's going to come in. So I call myself a counsellor. If I'm working in a health setting where people are looking for more expert, then they would probably be more likely to see a psychotherapist, if I can put it that way. But the thing about person-centered therapy, as I say, is if it's taught well, some people just think person-centered is the core conditions. So they don't know any of the underlying theory. They don't know about the actualizing tendency. They don't know. The theory is contained in 19 propositions that are at the back of client-centered therapy that Rogers and his colleagues identified. And really, if you haven't paid attention to those, you're not a person-centered therapist, in my view. Although you might have some of the, you might have some knowledge, but it's not really enough.
Hi, thank you very much for sharing. And what I wanted to ask was also about being non-directive. How do you know when? What does a successful outcome look like? Is it the client making a decision that they're happy with? And what if, in that example, Jasmine decided she wanted to stay with her abusive boyfriend and to put the kids in care, and she was happy with that? She decided being a mum's not for me, and this is what's best for me, even if it might not necessarily be good for her or good for those around her. But I'm stepping back and suspending that value judgment because I'm. So that's my question. What's a successful outcome? And maybe you could share, an example of where a client has made more better decisions.
And I will often say this to clients, is that a client feels calmer, that they feel more in control of their life, that they have some joy. Because one of the things that often happens with clients when they come to you is they've narrowed their feelings into quite a narrow band of feelings, which might be depression, because they're so scared of the graph, the low point to the graph. Yeah? So when we're talking with someone like Jasmine, who's got a huge amount of grief and distress, if she starts to come out of that narrow band of feeling and experience the distress, there's also the possibility that she's going to be able to feel joy. Yeah? So none of us can get away from feeling the lows of our lives. But in a congruent personality, we feel those lows. It's awful. It hurts. It's, but it's gone. They're not trapped inside us for long periods of time. And because we feel the lows, we can also feel the highs. So we can feel the joys, we can feel excited. I don't know whether that's answered your question or not, to be honest, have I? Okay.
Are you able to perhaps be a little bit more specific about the point that he raised, which was how one would feel about that outcome, where the client is with the boyfriend and the children going to care? Is there a version of success for you in that?
I don't think there is. I suppose I would in one sense be disappointed, but if the children were in a better place with people that could care for them and empathise with them and look after them better, then I could see that as a positive outcome. I mean, there's so many imponderables, aren't there, because this is a snapshot.
Maybe is the answer, really, isn't it? Maybe.
Yes. Yeah. Is that?
Hi. My question might be an ignorant question. In a person in a one-to-one context, what is the opposite of a person-centered psychotherapy?
The opposite?
Yes. Isn't therapy supposed to be always centered on the person that your patient? So when you say self-centered, what's the opposite of that?
Well, person-centered applies to a particular theory, a particular theory of therapy, as I've outlined. And yes, there's person-centered everything now, isn't there? There's person-centered healthcare and person-centered community care and person-centered. But it's not, I don't think it's based on this theory. So some people call themselves client-centered for that reason, because it's got, the term person-centered has been very diluted, really. So I understand where you're coming from. And I think you're right that, I don't know, furniture-centered, would that be the opposite? I have no idea.
Sorry, thanks for letting me have it again. I just forgot to say, well, I would think that the contrast is between non-directive and directive, maybe. But
yes.
I forgot to say, in the mediation training I had, they had a sort of catchphrase. I think they've dropped it now, but it kind of applies to the questions. They said, they gave us a lot of training on how not to be judgmental. And I don't remember the specifics, but the catchphrase was, be curious, not furious.
Yeah. Yeah.
Yeah, it's a little silly, but it sticks in the mind. So I think we were allowed to ask questions with that in mind to increase our understanding, and then reframe and feedback, be empathetic as well. We were a little more focused on problem solving, of course, because it was mediation. But be curious, not furious seemed to work.
Yeah, curious is, I think, good. Yeah. Okay. Yes, there's a 25% discount. That's the code if you want to order any of the books. The client issues takes life events, loss, bereavement, childhood sexual abuse, trauma, emotional reactions to those events, depression, anxiety, different realities, and behavioural reactions, drug and alcohol issues, eating problems, self-injury, and looks at them from a person-centred, theoretical and practice base. So, thank you very much, everybody.